Hi everyone, I am Dr. Anantapal. Today I am going to discuss is about the one of the most important topic, that is Guillain-Barré syndrome. It is very much important. It is coming in every NEET PG and INSET examination, and we all know there will be the outbreak will be the occurs in the different state of India. That's why it is a hot topic which is maybe coming in INSET and NEET PG examination. And I integrate the Guillain-Barré syndrome with the Campylobacter jejuni infection, so it may be the helpful as a revision to your study. And not forget to subscribe and like my video, and stay at the end of the video to see the very compiling study of the Guillain-Barré syndrome and Campylobacter jejuni infection. Guillain-Barré syndrome is an autoimmune polyradiculopathy disease. As the name suggests, autoimmune, because it is autoantibody will be the produce against something that is the Schwann cell. Now, Guillain-Barré syndrome will be the occurs because of some antecedent causes like Campylobacter jejuni infection, Zika fever can produce the Guillain-Barré syndrome, influenza vaccination, rabies vaccination, and some other disease like HHV infection and certain COVID-19 infection also predispose the Guillain-Barré syndrome. The most probably the Guillain-Barré syndrome will be developed before the developing the disease, patient having the history of diarrhea because of the consumption of certain poultry and milk containing food which is contaminated with the Campylobacter jejuni. Now, Campylobacter jejuni is also an important topic in microbiology which is coming in NEET PG as well as the INSET examination. Campylobacter jejuni is a gram-negative bacteria which is a oxidative positive microaerophilic which grow at 42-degree temperature. It shows the two different type of motility on microscope. It shows the darting motility like the cholera and swarming motility in the medium, and on microscopy it shape like the gull wing shaped. It is a produce the zoonotic disease. It is cultured in the Campylobacter media, Scleromedia, and Urgel media. The virulence factor, that means the factor which is released by the Campylobacter jejuni, are two types. One is enterotoxin, one is cytotoxin. Enterotoxin, which is act like the cholera toxin, that's why it can produce the diarrhea, and Shiga-like toxin act like the cytotoxin, which can produce the dysentery. The disease that is produced by the Campylobacter jejuni is GB syndrome, Guillain-Barré syndrome, food poisoning, and gastroenteritis. Laboratory investigation. On microscopy, if we do the Warthin stain, silver stain, it looks like the gull wing appearance, and rather than the microscopy, we can determine the toxic gene by the help of the ELISA and PCR test. The treatment of Campylobacter jejuni, that is ciprofloxacin, azithromycin, and erythromycin. Now, what is the pathophysiology of the Guillain-Barré syndrome? As we previously told, the Guillain-Barré syndrome is an autoimmune disease. Autoantibody will be the produce against the Campylobacter jejuni antigen. Now, this autoantibody is cross-linked with the Schwann cell, and which can destroy the Schwann cell. We know the Schwann cell play the important role in the formation of the myelin sheath in the CNS. That's why it can produce the demyelination of the CNS. And one of the variant of this Guillain-Barré syndrome, that is AIDP, acute inflammatory demyelinating polyneuropathy. As it is name suggests that acute because it is very rapid in progression. It is a most common type. It occurs in adult and children. Motor nerve is more commonly involved than the sensory component. Here the immune attack that is occurs on the Schwann cell. The antibody that is involved in the AIDP, anti-GM1 antibody. Now, when the disease is progress more than 9 weeks of onset of the disease or more than 3 relapse, then it is known as chronic inflammatory demyelinating polyneuropathy. The nerve involved here, the both motor and the sensory nerve is involved. If we do the investigation like all other cerebrospinal fluid examination shows the albuminocytological dissociation, and a nerve biopsy revealed that it is onion peel appearance. Treatment IVIG to be given, and as is the autoimmune disease, so antibody should be removed from the plasma. That's why plasmapheresis to be done. But steroids is not effective in the chronic inflammatory demyelinating polyneuropathy. Other variant like AMAN, acute motor axonal neuropathy. As the name suggests, it is a motor. It only involves the motor nerve. Here the immunoattack, that means autoantibody will be the attack the node of Ranvier region. The antibody involved anti-J1 antibody and anti-GD1A antibody. Another variant, AMSAN, acute motor sensory axonal neuropathy. Here both motor and the sensory nerve equally affected, and immune attack here like acute motor axonal neuropathy. Here also the node of Ranvier it is involved. The antibody is similar like auto acute motor axonal neuropathy. Here anti-GM1 antibody and anti-GD1A antibody both are involved. Another variant, that is Miller-Fisher syndrome, which is presented a patient as a triad of the symptoms: ataxia, areflexia and ophthalmoplegia. Antibody that is involved anti-GQ1B antibody. Now, what symptoms patient presented with GB syndrome? Patient presented mainly the ascending paralysis, which is symmetrical in nature, progress distal to the proximal region. Bladder is spared, but more serious infection, that is respiratory paralysis because of the bulbar palsy, and patient presented with the ventilation and death can be the occurs. Patient also develop areflexia and minor sensory loss also occurs. The investigation, as it can involve the nerve, so nerve conduction test should be done. In the nerve conduction test, nerve conduction velocity will be decreased, action potential decrease and loss of the F wave. Cerebrospinal fluid examination revealed that albuminocytological dissociation. In albuminocytological dissociation means the albumin is increased, no pleocytosis, but no increase in the WBC count in the CSF. It will be the appear 48 hours after the onset of the weakness, and it take the peak level at the 1 week of the onset of the illness. One criteria used for the diagnosis for the Guillain-Barré syndrome, that is the Brighton criteria. The treatment, immunoglobulin injection, remove the antibody from the body, from the plasma by the help of the plasmapheresis, and steroid have mild effective in case of the acute condition of the Guillain-Barré syndrome, but not effective in the chronic demyelinating polyneuropathy disease. So this is quite integration study of Guillain-Barré syndrome and Campylobacter jejuni, and that may be the helpful to an examination. Thank you for listening and giving the time.